Good day, everyone. So now we will going to continue our discussion about learners with attention deficit hyperactivity disorder and other health impairments and physical disabilities. So next is we have muscular dystrophy. Muscular dystrophy is a group of hereditary disorder that result in a gradual weakening and deterioration of skeletal muscles. So it is a group of genetic disease that cause a progressive weakness and loss of muscle mass. So it is a muscle disorder. It weakens our muscles over time that hindered us to act properly, such as to walk, run, climb, and any other movements. So it caused a poor balance, and some of them have thin thighs and shoulders. There is actually no cure for this since it is genetic, but treatment and therapies can help manage symptoms and slow the progression of the disease. Now we have spinal cord injury. So where is our spinal cord? Of course, is the back of our body. It is actually connected to our brain. It has a bundle of nerves connecting the brain into the rest of the body. So if it is damaged through accidents or injury, there is a possibility to be paralyzed or your body will feel numbed. So those paralyzed individuals, the part of their head will only function but their body won't no longer respond. So we are now in the treatment and behavior intervention for ADHD. So these are the treatment for ADHD individuals, the behavior therapy and medications. So behavior therapy, it is a type of treatment that focuses on teaching kids and their parents or teachers skills to manage ADHD symptoms. This includes having rewards whenever they follow your instructions or giving negative rewards to stop their improper behaviors. For instance, in positive behavior, some of your students always get distracted during class, and you instruct them that if they stay focused during your class discussions, they will receive a chocolate after the discussion. While in negative reinforcement, for instance, your student can complete a lengthy assignment, then you've decided to manage your assignments into smaller tasks for them to pass their assignment completely. So the negative reinforcement is the shortening of the assignments for them to pass. So here are the 5 types of medicine license for the treatment of ADHD. So first we have methylphenidate. It is a common ADHD medication. It increases activity in the brain areas that control attention and behavior, like giving your brain a boost to focus better. If they take this medicine, they could control their attention and behavior, therefore, they will be less impulsive and have a focus to certain things or in class discussions. So, next is lesdiamphetamine. Its benefits is similar to methylphenidate, but it lasts longer. The amphetamine, it increases also brain activity such as attention, concentration, focus, and many others. But it is often used when methylphenidate isn't effective enough. The next medicine is atomoxetine. It helps improve concentration and control impulses. And lastly is the guanfacine. It calms down certain parts of the brain that are overactive in people with ADHD, helping improve attention and reduce impulsivity. As you can see, they have the same purpose to maintain attention, concentration, and control their actions. Let us now proceed to teaming and related services. So this describe how program and specialists work together to work with students with disabilities succeed in school, most especially in physical activities. So first we have physical therapists. They provide motivating exercises or activities that help them to manage their actions. They develop their motor skills, especially the gross and fine motor skills of students. For gross motor skills, they help manage how they walk, run, or jump properly without feeling pain. And for fine motor skills, they help how students control their muscles in their hands and that are necessary for writing, eating, and dressing. So, having a therapy session with physical therapists help improves child's muscular function, reduce pain and discomfort, and address long-term physical damage. So these exercises and activities help disabled students participate in school activities without difficulties. Next is occupational therapists. They help students develop the skills they need to learn in the classroom activities. Since some students with disabilities have different difficulties in class, they help them how to organize their things, plan, how have time management, and practice their study habits. This helps them how to succeed in their studies. They also assess them on how to build a social skills with others to improve their communication with peers. Adaptive physical education. So these are the activities that are designed specially for students with disabilities since they can perform like how the normal students could perform. They actually modify the traditional physical education activities to meet the needs of students with disabilities and encourage their active participation in PE class. Their activities here is feasible for them to perform. So these services should include the following. First, we have assessment and instruction. So this means that all the professionals involved, such as the physical therapists, occupational therapists, and adaptive physical education teachers, have the right training and experience to work with children with disabilities. They know how to assess a child's needs and provide appropriate instruction. And next is accurate assessment data. This refers to the careful testing and observations done to understand each child's strengths and weaknesses. This information is used to create a plan tailored to the child's specific needs. This will be their basis on how to approach the child with ADHD problems. Next is the individualized education program goals and objectives or benchmarks. So it is a legal document that outlines students' educational needs and how the school will support them despite of their disabilities. It outlines here their objectives and how to help the children with disabilities succeed in schools. It includes maintaining their attention in class, improve their social skills and academic performance. Last is the instruction in a least restrictive environment. So this means that providing them with the most appropriate educational setting that allows them to learn alongside with their non-disabled peers while also receiving the necessary support and accommodations to succeed. It ensures that they can access the same educational opportunities as normal students. Here are the environmental modifications. So first, secure a seat that is a non-busy area inside a classroom for learners with physical disabilities. So of course, for them to be safe since their classmates could be clumsy. They need to be protected from physical injuries and disturbance. Not just that, but also for them to have a calm environment. Next, place paper cup dispensers in close proximity to water fountains to ensure accessibility for students using wheelchairs. We all know that water is life. We felt thirsty every time. How much more for those students with disabilities? So we should assure that our water faucets have cup or glasses beside it that are very accessible for them to take, most especially those students who wears wheelchairs. The third one is relocate a class or activity to a section of the school building that is easily accessible, allowing students with physical activities or disabilities to take part. So, when you're going to have an outdoor activity for your students, make it sure that disabled students could join without having difficulties and won't feel out of place. So, for instance, you're having a science experimentation in other building, make it sure that that building has an elevator for wheelchair students to join. Next, offer gel pens with a low pressure requirement for writing. So, there are actually two types of pens, the ballpoint pens and gel pens. So, ballpoint pens are pens that quickly dries. They provide high pressure in writing due to its ink use. When you use this pen, you'll get tired as easily. Did you know what is gel pens? Gel pens are those pens that are smooth and comfortable to use. It has a low pressure in writing that help us write longer without exhaustion. So usually gel pens takes longer time to dry. Have you observed that pens? We should suggest these pens to the students with disabilities for them to write comfortably. Next, offer a head-mounted pointer stick and keyboard protector to assess students with impaired fine motor skills in accurately pressing individual computer keys. So this is good for those who cannot move or use their hands due to disabilities. This is also expensive and only rich individuals could afford. Adjust the desk and table top to suited heights for students who are of shorter stature or who utilize wheelchairs. So we must also provide them with comfortable seats by asking them if that is enough for them to ride comfortably. Offer a wooden pointer to facilitate the students' access to higher buttons on an elevator control panel. So, for those who used wheelchairs, they could have a stick to click some higher buttons, such as when riding elevators or emergency buttons during fires. Next, modify response conditions to permit written or oral answers interchangeably. So we should not only let them write always and expressing their ideas, but also encourage them to speak because there are some students that are good in writing while others are in speaking. Assistive technology. So these are the technologies that designed for people with disabilities. It assists them to do the things that their body hardly perform. So imagine without these technologies, what would happen to them? So probably life could be too hard for them to live. They might lose hope for their situations. These technologies provides a great benefits for them to succeed in schools and to be educated. Normal people even get tired of living. How much more for them to have who have those kind of conditions. So that is why we should always be kind and avoid discrimination and bullying. Students with ADHD, other health impairment, and physical activities benefit the most when placed in an inclusive classroom. Why? Because through inclusive education, they will feel belong and have social life with others. It doesn't mean that they have disabilities, they should be separated or isolated. No, it's not. There's a comfort for them despite this serves as a comfort for them despite of their situation. They could also learn like how do normal students learn. As much as we would like to be inclusive, severe health impairments and physical disabilities require 24/7 monitoring from physicians and treatment at home. So while we encourage inclusivity, the monitoring of those with disabilities must be consistent, most especially those who have severe problems for them to maintain their health and to prevent accidents or injury. There should be a consistent checkups.